All right, I think we're finally getting this on. All right, guys, I want to thank you guys for joining me today. So I am so sorry about the technical difficulties, but if you're joining me for the first time, my name is Dr. Islam, and every Monday, typically I go live on your social media streams. If you haven't already, don't forget to smash that like button, like, share, and subscribe. Robert, or is it Sally? I'm not quite sure. Thank you for watching on today's live stream as well. All right, I'm late. I know I'm late. I'm sorry. We had a lot of technical difficulties. I had to use a new camera. I had to reset my internet. I had to get everything straightened up, but it's okay because I'm here with you guys today. I want to thank you for joining me today. So, a couple of things. So, number one, like I mentioned before, we are going to change the format. We're still working on this. I'm hoping in the next couple of weeks we'll have a podcast format so we can give you guys the information that you need. Number two, don't forget to like, share, and subscribe. And let me know if you're watching this live or on the replay. And also, number three, let me know what your questions are, where you're watching this at, what you guys have topics on, because we'll go into a deep dive, your own personal office hours from yours truly on today's Poop Scoop Monday. All right, so today we're going to be talking about, I'm going to give you some brief overview and some common GI conditions, IBS, GERD, inflammatory bowel disease. We'll talk about symptoms, diagnosis, and possible treatments. We'll talk about nutrition and your gut health, how food is medicine, and my thoughts behind that. We will talk about what you can do to prevent GI issues from occurring, and we'll talk about fatty liver disease, probably the most common liver disease that's out there. And so I hope you guys are joining me today. So Sally, good seeing you. Christina, thank you for watching as well. So appreciate you guys watching the live stream. All right, topic number one. Most common GI conditions that I see. Sorry, let me do that one more time because I messed it up. So, what are the most common GI conditions that I see in my clinic, and what do I do to kind of help manage those? So, we see a lot of things in a gastroenterology clinic. Basically, wherever your food goes, I go as well. And so, it can start in the mouth, the esophagus, going to the stomach, the small intestine, the colon, yes, even your rectum, hemorrhoids, liver disease, pancreas issues, bile duct disease, gallbladder issues, everything that you can involving your digestion, we are involved with it. However, there are common conditions that I see all the time that my patients have that they're wondering what they can do for that. I'm going to give you a lowdown on some of these most common conditions. So one of the more common conditions I see is a condition called IBS, or irritable bowel syndrome. Let me know in the comments down below if you suffer from IBS or if you know somebody who has IBS as well. So IBS, let me tell you, the way I approach it, it's number one, it's a real disease. It's not in your head. You're not going crazy. I promise you. There are a lot of manifestations of IBS. You have a couple of main types. You have IBS D, D for diarrhea, IBS-C, C for constipation, IBS-M, a mixed pattern in which you can fluctuate between diarrhea and constipation, and IBS-U, which is unclassified, meaning it doesn't fit in those nice definitions of what we have in the medical terminology for IBS. However, we use IBS as a term mainly for research, but in real life, people can have all sorts of symptoms when it comes to IBS, whether it's bloating, pain, diarrhea and constipation, upset stomach, maybe even heartburn or some gas as well. These can all be manifestations of a condition called IBS. So what do I do as a GI doctor to figure out what is going on? Well, obviously, most important thing, history and physical. When you look at the studies when it comes to IBS, most of us can diagnose somebody with IBS just by the history and physical alone. So kind of keep that in mind. But sometimes we may need a workup to find out exactly what is going on. So we may do routine blood testing. In some individuals, we may get stool testing, especially if we're worried about inflammatory condition. And for others, we may want to consider taking a look to see what's going on. There are common mimickers of IBS, including things like celiac disease, gluten issues, food allergies, EPI or exocrine pancreas insufficiency, or small intestinal bacterial overgrowth or SIBO. And sometimes even something like colon cancer can mimic IBS. So for some individuals, we actually want to take a look with endoscopy and see exactly what's going on. That will allow us to rule things in, but also allow us to rule things out as well. So it allows us to rule things in, but also rule things out so we can exclude what is going on. Now, when we have somebody who has IBS, there are a couple different approaches that we take. What I always tell my patients is that we have two main routes we can go down when it comes to your IBS. For some people, we can try natural options depending on their symptoms, dietary changes, probiotics, prebiotics, natural supplements, stress management, and for some individuals, that will help control their IBS symptoms. But for others, it may not work, and that is okay. And for those individuals, we can consider doing medical therapy. I don't ever want you to be afraid of medical therapy because it is perfectly fine to take that. And depending on the right patient, we can give them prescribed medications to help out with their IBS. But IBS is a very common disease that I see in my clinic, and we treat this all the time. Let me know in the comments down below if you have IBS, you know somebody who has IBS, or you have specific questions about IBS. The second most common condition that I see is reflux or GERD. So GERD is gastroesophageal reflux disease, and it can manifest as two main symptoms. One is heartburn. The other one is regurgitation of things coming up. Those two are kind of within the spectrum of gastroesophageal reflux disease or GERD. Now, how do we diagnose GERD? Once again, a clinical history is what we need to see if you have GERD or not. So if I have a patient telling me I have heartburn or I have regurgitation and they feel better by taking acid reducing medication, they have GERD. That's what it is. For some people, we may want to confirm that, or if we're worried about a complication from GERD, we can take a look with the scope to see exactly what's going on. Now, there are some significant complications that can occur with long-standing GERD. So things like Barrett's esophagus, strictures or difficulty swallowing, even esophageal cancer can be a risk factor for GERD. So did you know that GERD can lead to cancer? A lot of my patients are not aware of that and they don't know what's going on. But with that upper scope, I can see if that's the case. Do an evaluation. We can check for hernias, ulcers, irritation, inflammation to find out what else we can do to get things taken care of. And based on that testing, we can find out what options we can do. We can try medical therapy. It works for a lot of our patients. We can try lifestyle changes, losing weight, not sleeping late at night, elevating head of the bed, minimizing the trigger foods, taking things like licorice or even baking soda or DGL can help out. Or we can try surgical options, which are very effective in the right patient when it comes to the GERD. So when someone comes to see me, I want to make sure we have a comprehensive workup that we can work together to find the right approach for you, depending on your symptoms, depending on you feel, and depending on what we're trying to treat as well. The last common condition that I see is a condition called IBD or an inflammatory bowel disease. In fact, I had a patient last week who came to see me who actually was diagnosed with this condition. Now, IBD, there's two main spectrums of IBD. There's Crohn's disease, then there's ulcerative colitis. Now, they can present in many different ways. Pain, diarrhea, weight loss, fevers, arthritis pains, joint issues, nausea. It can be a whole constellation of symptoms. And so because IBD can be sometimes nonspecific, we may need multiple tests for us to find out what is going on. That includes imaging, blood testing, stool testing, even a colonoscopy to see what's going on. And we can see the damage going on inside the gut when it comes to inflammatory bowel disease. And so when someone has this, there are two approaches that I take to control their symptoms. If they're in an immediate flare, their body's on fire, and we have to break down that fire. We have to turn it down. And so the only way to do that is with medical therapy. We have to put water on that forest fire to get things down. Once we calm things down, then we can try natural options to get them taken care of, whether it's dietary options, whether it's supplements, whether it's other things that we can do. These things work in the right individual to get their inflammation down. But the first thing we need to do is calm down their inflammation so we can get them feeling better, and then we can start to introduce lifestyle changes as well. These are the most common things that I see as a gastroenterologist in my clinic. If you're worried about this, if you think you have this, if you're wondering, hey, that sounds like me, come see me at Lubbock Gastro, where we can find out exactly what's going on and hopefully delve and understand why you're having your issues as well. These are very common conditions to have. All right. So, well, guys, want to see a couple of things here. So, perfect. All right, Robert, thank you for here. So perfect. All right, so one question that so Christina asked a good question. What are some things to be aware of after gastric bypass? So gastric bypass is one of those surgeries which is very effective in the right individual to help you lose weight. Basically, you're bypassing part of your gut, and it actually does wonders when it comes to weight loss. However, there are some deficiencies that you may develop because of gastric bypass. So for some people, you can develop some nutritional deficiencies. There's a higher chance of developing an ulcer. There's a higher chance of developing abdominal pain, and you can have dumping syndrome or pretty significant diarrhea as well. These are not common complications, but they are complications that can occur when it comes to gastric bypass surgery. Just kind of be aware of that so you know exactly what is going on. All right. So, question number 2. Hey, Dr. Islam, what is the role between nutrition and gut health? So let's talk about this. So, and if you see me for a long time, I'm a big proponent as food as medicine. I really do believe that what we eat affects how we feel, affects our gut microbiome, and affects exactly how we can manifest our health. And so I'm going to give you 5 tips I recommend for everyone to take today that if you do this, it will change your health, it will change your gut microbiome, and it'll change the way your body feels that way as well. So tip number 1, you want to try to see if you can improve or increase the amount of plants in your diet. Plants are the backbone for gut health. It gives you the fiber, the vitamins, the minerals, and the nutrients to give you the best gut health that you can. And it's nature's way of providing you a superpower to get you the health that you need. Plants have everything that you need to get you feeling better. So the first thing I always recommend is to try to incorporate as many plants into your diet, especially a variety of plants, which is tip number 2. Don't just focus on one plant, have a variety of plants. The biggest predictor for improving your gut microbiome, which I feel is the basis for your health, is the diversity of plants in your diet. There are studies and studies showing that plant diversity is the best predictor for health and to help you live longer, to decrease your risk for cancer, and to decrease your risk for having gut disease. So try to have plants, but a wide diversity of plants. Tip number 3, if you are smoking, don't do it. This is 2024. You know smoking is bad for you, and it can tear up your gut and tear up your gut microbiome as well. I have so many patients who I've diagnosed, in fact, even today, who actually ended up having an ulcer in their stomach because of the smoking that they were doing. So smoking can just tear up everything that's going on inside, and it can change how you feel, change your gut microbiome, and also make things worse for you as well. Tip number 4 is try to eliminate processed foods. Processed foods, especially ultra processed foods, it's the way to kill your body from the inside out. Processed foods are not good for you. They taste great. I know they do, but they're not good for your gut and they're not good for your health. And those processed foods develop additives and inflammation and destroy what's going on the inside. And the more you have of that, the worse it's going to be for your overall health, and the worse it's going to be for your gut microbiome, but also your health in general. So if you can eliminate that, it's going to help out. And then lastly, get rid of sugars, especially excess sugars. Sugars are like nature's way, or like it's a way right now going on that is really tearing things up on the inside. Sugars, especially unnatural sugars or sugars that are not in natural foods, are not good for you. So this is different from sugars and fruits, which are good for you. They're part of the ecosystem of health. It also provides you the fiber that you need whenever you have a whole food. But you add in sugar, so things that are sugarated, for lack of a better word, or things like regular drinks, pizzas, ice cream, candy, they all have sugar. These are not good for you. And the more sugar you have, the worse it's going to be. It ends up being a vicious cycle where you have sugar, and as soon as it goes out, you crave more sugar to feel better. So you have even more of it. You crave more of it and more of it, and it gets down, and it ends up being a vicious cycle. And your body physically and mentally gets addicted to that. So if you can do what you can to eliminate it or minimize that, your body will thank you and you'll do so much better. If you do these 5 things, this will dramatically improve your health. You can maybe even get off medications, get off your pills, and treat yourself naturally. All right. If you're joining for the first time, my name is Dr. Islam. Yes, I'm a board certified gastroenterologist trained at the Mayo Clinic. Come see us, love a gastro for all your GI needs. And if you haven't already, don't forget to smash that like button, like, share, subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter, or come see us. We can delve to the root cause of what is going on to hopefully get you feeling better as well. Let me know if you're watching this live or in the replay. And also let me know if you have any questions, put in the comments down below. All right, next question. Hey, Dr. Islam, what are some preventive strategies that I can do to make sure I don't have to come see you? All right, okay, great question. I'm not offended, and that's okay. Now, I would love it if everyone didn't have to see me, though you will have to see me at some point in time when you need your colon cancer screening. But there are things that you can do right now to make sure you optimize your health to get you living your best life. So tip number one is find time to exercise. I don't care. I don't give a flip how busy you are. If you follow me on my stories, you know what my schedule is like. I make a concerted effort every single day to do something physical. Now, I know you can do. We all have the same 24 hours. You need to commit to yourself to work out every single day, whether it's going for a walk, doing push-ups, doing something. Do something physical every day. If you do that, you'll keep me away. Tip number two is to try to incorporate more plants into your diet. Plants are the backbone for all of health. It can help out with your heart, your gut, your pancreas, your liver, your diabetes, your everything. There's really nothing that plants can't do. It is nature's magic food. So incorporate more plants into your diet. Tip number three is to get your preventive health screening test, meaning get your mammogram, get your ovarian exams, get your colonoscopy so we can make sure we can prevent things from getting worse. I want you to think of these tests as car maintenance for your body. You don't want to wait until your body is run down or the check engine light comes on or you're having issues before you come see us. Find us before you have issues so you don't have to worry about those issues later on. Tip number four is to try to incorporate stressful ways to manage. Sorry, let me do this again. So tip number four, try to find ways to manage your stress. Stress plays a significant role when it comes to your gut health and how you feel. And we have to find ways to manage stress better. We are all living stressful lives. We always have, we always will. Everyone literally has stress, but it's how we manifest that stress or it's how we react to the situation that'll make a difference in how you feel. So for example, today I was not in a good mood today. I don't know why. I think I was just tired and I had a long weekend. I had a lot of things going on with the kids. And so I knew I needed to find some way to kind of manage what's going on mentally. So I took some time to go outside and just be with nature. 5 minutes, that's all it took. That was my way to de-stress myself. And I felt so much better from that. I would encourage you to do that as well. The last tip I want to recommend is to prioritize sleep. Too many of us, including yours truly, we don't do enough when it comes to sleep. We really need to find a way to prioritize this in our life. Sleep is critical for your mental well-being, your physical well-being, and just feeling better overall. And so you need to find ways to hopefully manage that sleep so we can get that taken care of and hopefully get you feeling better. These are 5 tips that I recommend that if you do, will allow you to maybe not only not see me, but maybe not see any doctor for a long time. All right, if you're joining me for the first time, my name is Dr. Islam. Yes, I am your poop guru. My passion is to give you guys the best tips and tricks so you can live your best life. If you haven't already, come see us at Lubbock Gastro for all your GI needs. Don't forget to subscribe to my channel for more information as well. All right, perfect. All right, so last tip. Hey, Dr. Islam, I got fatty liver disease. What the heck do I do? So let's talk about this. So fatty liver disease is now the most common cause of liver failure in the US, not just liver disease, liver failure. And there are 2 main reasons why people have fatty liver disease. One is too much fat. That is simple as that. If you have a big belly, you're going to have a big liver. But the second most common reason is alcohol. Alcohol itself can cause irritation in the liver, to cause fat to accumulate, to cause damage to occur as well. And so if you have fatty liver disease, there are a couple things that we recommend. So number one is that we want to get imaging on your liver to see how your liver looks. And number two, we also want to do a score to see how much scarring is in that liver. What's important for me is not that you have fat, but is that fat causing damage? Because it's that damage that over time will cause complications to occur. And we need to make sure you don't have that damage that can cause worsening issues for you in the future. We also want to do other blood tests to confirm there's no other cause for your liver inflammation. So we can check you for autoimmune diseases, genetic abnormalities, other liver viruses that can cause issues as well. If we do all of this, this will give us a better idea. A, do you have fat? Number two, B, the degree of fat, and also C, is that fat causing inflammation or is it causing scarring to occur? Now, let's say that you've been diagnosed with fatty liver disease. A couple things that I recommend. There are some foods that we recommend that can help out. Coffee, black coffee, 2 or 3 cups per day, whether it's decaffeinated or caffeinated, has been shown in studies after studies after studies to decrease inflammation in the liver. So incorporate that. Number two, incorporate fiber into your diet. The more fiber that you have, the less inflammation you're going to have, the better it's going to be for your liver as well. Number three, try to minimize or eliminate as much carbohydrate as you can. So pizzas, pastas, cookies, tortillas, fajitas, these things, bread, cookies, these things are known to cause inflammation to occur. If you're able to minimize that, it's going to help out. Number four, exercise. Exercise is essential when it comes to liver disease as well. It can help out to decrease inflammation. And then lastly, there are certain supplements that in the right individual can help out. I'm not going to give you that because if you want to know more, I need to see you as a patient, but also need to make sure you don't have any reason to not be on a supplement. But these are things that we recommend when it comes to fatty liver disease as well. All right, guys. I want to thank you guys for watching. Sorry I was late. If you haven't already, smash that like button, like, share, and subscribe. Come see us. Come see me at Love a Gastro, where we can find out what's going on and hopefully get you taken care of. I want to thank you for watching. And hopefully we'll have everything set up for some new projects coming up. I want to thank you guys for watching. Hope you guys have a great day and take care.